Buried in the monumental underperformance of the health care law has been some monumentally underdiscussed good news. Nearly 400,000 Americans have successfully enrolled in expanded Medicaid coverage under the Affordable Care Act. That is 396,000 Americans who now have access to life-saving treatment who did not have it before. In addition to subsidies for private insurance, the Affordable Care Act expands Medicaid coverage up to 138% of the federal poverty line, which is about $16,000 for an individual this year. The expansion is also leading to something called the woodwork effect, where patients who were already eligible for Medicaid come out of the carpentry to enroll in the federal plan. As Kaiser Health News points out, about 120,000 of the new enrollees were already eligible for Medicaid coverage. They just didn't know it until the law went into effect. But as with all things ACA, expansion does not come without hitches. So far, 25 GOP-led states have refused the expansion, and their choice is getting even worse. To pay for the Medicaid expansion, the law cuts subsidies to the hospitals that take on a large share of uninsured patients. The logic at the time was if hospitals were getting more patients through expanded Medicaid and private insurance, they wouldn't need as much assistance from the federal government. But now, many states will get neither the new patients nor the federal subsidies. In Georgia, 3 rural hospitals have already closed this year. The New York Times tells the story of Donna Atkins, a waitress in Savannah, Georgia, who was recently diagnosed with throat cancer. Donna was advised to get a specialized image of her neck, but it would have cost $2,300, more than she makes in a month. "I didn't have the money to even walk in the door of that office," said Ms. Atkins. Atkins had surgery last Friday, 2 years after her first symptoms. It is unclear whether Ms. Atkins, whose income is right around the poverty line, will be left without Medicaid or if she earns enough to qualify for subsidies to buy private insurance on the federal exchange. In the meantime, 15 more Georgia hospitals may be shuttered, leaving patients in need without recourse.